All right, let's jump right in. Today, we're going to pull back the curtain on a really powerful but surprisingly simple technique that's a cornerstone of physical therapy. It's something that can literally kickstart the entire healing process. So let's get into it. But first, let's start with a question that, honestly, is super relevant to so many of us. What actually happens when a part of your body is forced to stay still? The answer? Well, it's a much bigger deal than you might think. To really appreciate the solution, we've got to understand the problem. So first, we're going to look at what causes us to stop moving in the first place and the domino effect that kicks off inside our bodies. Look, our ability to move can get sidelined for all sorts of reasons. It could be something major, like a big surgery or a bad injury, but it can also be something as simple and incredibly common as just not moving around enough for a long time. Basically, anything that forces a joint to stay put can start this whole process. And this is why it's so important. The second a joint stops moving, a whole cascade of negative stuff begins. You can think of these as the villains of our story. Nasty scar tissue, called adhesions, can form and basically gum up the works. Tissues can actually shorten. Those are called contractures, and they physically block movement. Your circulation gets sluggish, and even the slick, healthy cartilage in your joints can start to break down. So how in the world do we fight back against these villains? Well, to understand the tools in the therapist toolbox, we need to learn a little bit of the language they use. It's the foundation for everything that's coming next, so stick with me here. Okay, first and most important term, range of motion, or what you'll almost always hear called ROM. It's exactly what it sounds like. It's the total, full amount of movement that is possible at any given joint. So when we talk about your shoulders ROM, we're talking about that whole arc, every bit of movement your arm can make. Now here's where things get really interesting, especially with muscles that cross two joints, like your hamstrings. Imagine this. Try to fully extend your hip back and bend your knee at the exact same time. You'll feel that your hamstring gets so short, so bunched up, that it can't really pull with much force. That's active insufficiency. It's like a rubber band that's gone all slack and has no snap left in it. And of course, the opposite is true too. Now try to fully lift your leg straight up in front of you, keeping your knee locked straight. You feel that deep stretch in your hamstring that physically stops you? That's passive insufficiency. Now our rubber band is stretched so incredibly tight that it's preventing any more movement. So let's just nail this down. Active insufficiency is when the muscle is too short and bunched up to work right. Passive insufficiency is when the muscle is stretched so long it physically can't go any further. Both of them limit your motion, but for completely opposite reasons. All right, now that we've got the lingo down, we can check out the different ways therapists actually work to get that movement back. There are three main kinds of range of motion exercises, and each one has a very specific job to do. And this table just lays it out perfectly. You've got active ROM, or AROM. That's all you using your own muscles. Then there's active assistive. That's you doing the work, but with a little help. But look at passive ROM. PROM. The force is totally external. A person or a machine is doing all the work. The patient does absolutely nothing. And this is our hero for today. So let's really zero in on the unique power of this technique. Passive range of motion is the direct counterattack to all those problems, those villains we talked about at the start. It's the first line of defense when your body literally can't, or really shouldn't, move on its own. So, when is this the right tool for the job? Well, it's absolutely crucial right after a surgery, when everything is swollen and inflamed, and trying to move on your own would actually cause more damage. It's also essential for patients who physically can't move themselves, maybe because of paralysis or because they're in a coma. It's what stops those terrible complications from setting in. So with all of that in mind, what is the single biggest, most important goal when using passive ROM? It really boils down to one simple, incredibly powerful idea. This is it. The number one mission is to fight back. It's to stop those adhesions, contractions, and poor circulation dead in their tracks, to prevent all the bad stuff we know happens when the body is forced to be still. It's basically proactive, preventative medicine in its purest form. And when we break that big goal down, you see all these amazing smaller benefits. We're keeping joints from getting stiff, keeping muscles from shortening, helping blood flow, and even helping to get nutrients into the joint cartilage. On top of all that, it can help reduce pain and even helps a person stay mentally connected to that part of their body. Okay, that all sounds great in theory, but what does it actually look like? How is this done? Let's walk through how a therapist actually puts this gentle but powerful technique into practice. What's so crucial here is the amount of care and control involved. It always starts with communication, letting the patient know what's about to happen. Then it's all about making them comfortable and stable, supporting the limb correctly, and then moving it. But here's the key: smoothly and slowly through a range that is completely pain-free. It is never, ever forced. This isn't about stretching, it's about gentle, rhythmic guidance. And of course, safety is everything. There's a huge difference between a precaution, which just means be careful, and a contraindication, which means stop, do not do this. A therapist will always stay within what the patient can tolerate and watch for any signs of pain. But they will stop completely if there's any chance the movement could mess up the healing process, or if there's a serious medical issue like a blood clot. And this brings us to the most important part of the whole story. Because all these techniques, all this careful work, it's not just about numbers on a chart. It's about giving a person their life back. Because at the end of the day, who really cares about gaining another 10 degrees of elbow movement? It's meaningless by itself. What truly matters is what that extra movement allows you to do. The goal is always, always function. It's about having enough range in your shoulder and elbow to simply bring a fork to your mouth, a fundamental act of independence that we so easily take for granted until we can't do it. It's about that complex movement in your shoulder that lets you do something as simple as brushing your own hair. These are the things that give us our dignity back. And yeah, it's about having enough movement in your hips and knees to just bend down and put on your socks in the morning. These little wins are what recovery is all about. So you see, passive range of motion isn't just some clinical exercise. It's a bridge from injury back to independence. It reminds us of a fundamental truth. Movement, in any form, is a key ingredient for healing. Which really just leaves us with one final thought. Movement is medicine. Are you using yours?